Hello everyone and welcome. I'm Adam Kless. I'm the Vice President of Clinical Operations for Avant. And with me is Erica DeMoss, the manager of the Clinical Transitions Program at Avant. And we're here to give you another tip for being a successful nurse in the United States. Today we're going to talk about the number one complaint we get, and that's communication. Communication in healthcare is of critical importance. Did you know that most errors that occur that harm patients are related to communication? I've seen it in my time in the hospital. Erica has seen it as well. So successful communication is going to be of great importance for you. And as we've mentioned in other tips, nurses, we're central to that communication. You're going to be having to communicate with people that you may not have ever run into. You're going to have to communicate with a physical therapist, with a pharmacist, with a doctor, with a nurse practitioner, with a respiratory therapist. There's so many other healthcare professionals in the hospitals here, and you're going to have to learn that you, as the registered nurse, you're the center. You are the only person that is responsible for the holistic care of that patient. Respiratory therapy is managing the vent and managing the lungs, but you're still responsible. So we're going to spend some time today talking about communication. And we want to focus in on, first and foremost, something that I hope you've heard about, and that's how U.S. healthcare is very service-oriented. Patient experience is critical. So we surveyed patients in the United States about their hospital stay. When I was at the bedside, I used to joke and say, come on, aren't you happy we saved your life? I mean, we coded you, we brought you back from the dead, and you're going to be upset because your soup was cold? Really? Well, guess what? That happens. And I've had that exact same thing happen to me back when I was a chief nurse and somebody complained. So we want to talk about how we make the patient feel, how we engage them when we're caring for them, how we engage them and their families. Families are heavily involved nowadays, and families sometimes fill out that patient experience survey. So Erica, you have to teach this.
Absolutely.
We bring people in that come from hospitals where the patients are happy just to be getting care and medication to, now, my pillow wasn't soft enough, or my nurse was abrupt with me.
Absolutely.
How do we teach this to our nurses? How do we teach to communicate properly?
Well, so first off, number one of the things to understand is our patients have a choice. They don't have to come to our hospital. Prime example, I have family that live out in the middle of Iowa, practically in the middle of a cornfield, and their closest hospital is 20 minutes away, but they choose to go to one that's almost an hour away just because of the care that they receive. And a lot of that does come down to communication. I'm going to ask you to imagine yourself as a patient. You're a patient that needs a Foley catheter. Worst procedure we do as a nurse, period.
No.
End of story.
Yeah.
Absolute worst. But I want you to put yourself in the role of a patient. So now somebody's come up to you, they've lifted your gown up, they've pulled your blankets down, you're completely exposed. Pretty vulnerable. And they're not talking to you. It's dead silent, they're focused on all the stuff they're doing. And so what happens to you as the patient? You start thinking things, and you start thinking weird things, and the longer the silence goes, the weirder those thoughts go. I'm not going to go into them all, but you start wondering, like, what are they thinking? How's everything going? What's wrong? Am I okay? And I know this because A, I've had it happen, and B, I've had patients tell me when I talk, because I talk nonstop when I'm putting in a catheter. Even if it's I'm opening up my kit, I'm putting on my gloves, I'm setting everything up so that I can keep you nice and safe. Key word. Always use the word safe anytime you can. That's another thing. Just helps them feel more comfortable that you're caring about those things. But I talk to my patients through everything and narrating my care. It helps to put your patients at ease. They always know what's coming. And it also keeps them occupied because they're listening to what you're saying instead of wondering about what you're doing or wondering if everything's okay. Now, Adam also mentioned about families. Families are huge. And I've done this, I've walked in, I've gone straight to my patient, they've got family members sitting there, and I've ignored the family and just talked to the patient. That's one of the worst things that you can do. We teach AIDET here. If you're not familiar with it, I highly recommend you look up AIDET. It's AIDET. It's a communication framework that helps you to kind of focus your communication, make sure you're providing the proper information. And part of that is acknowledging your patients and any family members or visitors that might be there. And you don't even necessarily have to say something, as long as you look towards them, give them a nod, a smile, let them know you realize they're there. Just those little things can put everybody at a little bit slightly more comfortable, and it helps to improve everybody's perception of their care and their stay.
You know, you made me think about something that I used to tell my nurses when I was in the hospital. You know, patients have nothing better to do than to lay in the bed and think and wonder, count the ceiling tiles, and listen.
Watch the clock.
Watch the clock. Listen to what we as nurses are doing out in the hallway or at the nurses' station. What are we saying? So, you know, I wonder about, you know, how we get the patient to think about something else. I used to talk about anticipating, and so sharing with the patient when they can expect to see you next, or what might be the next task we have to do. Can you tell everybody around the world what we do here in clinical transitions to help them learn that?
So that is part of every skill that we do here when we're practicing. I mentioned AIDET, and that's something that we include in all of our skills checklists. And that anticipation, that letting people know when things might happen, that's that D part of the AIDET, that's the duration. When can you expect something else to happen? When can you expect your nurse or your doctor to come back? When can you expect test results to come back? You know, giving patients that type of information is a key part to that satisfaction, and also to alleviating some of their stress and that fear of the unknown, because they know, you know, I can expect this around this time. So that's something, again, with every skill that we do, we include the various steps of AIDET, making sure that, you know, our nurses are talking to their patients and, you know, explaining what they're doing, answering any questions that they might have.
And, you know, I know a lot of times nurses say, I'm too busy, and
You're not too busy to care.
Too busy. So talk more about that. How is it that if I've got an admission and a discharge and I've got pain medication due and I have a patient that's a fresh post-op, like how am I supposed to make all that happen and be super nurse?
It's not easy. I'm not going to say nursing's not easy. We know that. But that's where prioritization can come in. But, you know, explaining to your patients, giving them that time frame. You know, I'd love to answer your questions and spend more time with you, but I have, you know, a small thing I need to take care of, but I can be back in 10 minutes, 15 minutes, a reasonable time frame, you know, so that you can address those other things. Or, you know, if it's something that somebody else can help out with, say, you know, let me get somebody else that can help you out with that, so your patients don't feel like you're abandoning them. And it's all about communication. You don't just want to walk out on your patient. You know, if you have to leave, they understand, but you need to explain it to them. And I've seen it here. People aren't used to doing that, and they'll just walk right out. And if I'm the patient, I'm left wondering, well, what's going on?
So there's certain things we shouldn't communicate as nurses?
Yes, absolutely. Never communicate frustration. You know, I tell all of our nurses, you know, don't complain about your work environment. If you come in and it's taking you longer and it's because you're short-staffed, don't tell your patients that. They don't care. They really don't. They care that you're providing them the best level of care that you can. So if you're later than you thought you would, you know, apologize, address it, but leave off the fact that you're short-staffed. We don't ever want to communicate that, because that increases anxiety. Oh, you're short-staffed. Are you sure you're able to take care of me? You also don't want to complain about your coworkers. Again, we want to encourage trust in the people that are taking care of our patients. So we avoid complaining about our workplace, our coworkers, our staffing. You know, complaining about if you've got problems at home, leave those at the door when you come in. You know, when you're there, you're focused on the best possible care for your patient.
That's really good advice, because I know sometimes we think that we want to be super transparent, but I mean, for a patient, does it really help them, right? Does what you're saying add value to their care?
It adds
right?
stress a lot
Yeah.
of times if you're trying to make excuses as to, oh, we're short-staffed. Again, they don't care. They just care that you're doing the best for them that you can.
Right. And I think with what Erica said about, we're short-staffed or I'm busy, sometimes what happens is the patient feels sorry for you as the nurse, and they won't want to bother you. So they might try to take themselves to the bathroom, and guess what? They fall. They fall and they get injured. So we want to make sure that the communication that we provide to patients and families adds value to their care and is pertinent to the situation that the patient is in. So that's another tip. I hope you found this helpful. There's a lot you can do now. You can get online, AIDET, big deal here, sbar, big deal here. So Google those, look those up and see what you can learn ahead of time. And why don't you learn it now and impress your clinical instructor here at Avant when you get here that you already know how to do those things. So I hope you enjoyed this, and we are very excited to have you come join us and can't wait to see you be successful as a U.S. nurse. Take care.